Mycle Brandy is walking and talking.
Hi, how are you today?
Good, how are you?
Good.
For a cause. On Valentine's Day, the California resident and four-time stroke survivor began trekking across America to call attention to a health crisis that affects nearly 800,000 Americans a year.
I'm trying to raise awareness that strokes kill, but they don't have to.
Which is what brings Brandy to Barnes Jewish Hospital on this busy summer morning. In every city along the way, Brandy has had just one request: to visit a local hospital with a dedicated, high-performing stroke unit.
One that saves lives. I want to see people that save lives. You here.
Nice to
All
meet
right,
you, sir.
nice to meet you too.
At Barnes Jewish, the group that greeted Brandy included stroke survivors and the health professionals who saved their lives.
I thank God, and I also thank Barnes for knowing what to do.
Darnell Marshall was undergoing kidney dialysis in Maryville, Illinois, when he realized his right side had suddenly become numb. The dialysis center was located near another hospital, but the clinic's nurses told the ambulance crew to take Marshall to Barnes.
They were ready for me when I got here. The ambulance had called ahead, and they were waiting on me. They took and administered the medicine, and in somewhere within about 10 minutes, it felt as if though I had feeling coming back in my right arm.
That miraculous outcome is actually standard procedure at Barnes. 3 years ago, the hospital's Stroke and Cerebrovascular Disease Center began implementing Get With The Guidelines, a national certification standards program coordinated by the American Stroke Association.
It assures that patients like Mycle and Darnell that come in through the emergency room department are treated with the best evidence-based medicine that gives them the best outcome.
All the nurses in the ED and the physicians, they have an acute stroke protocol they put into place once they know a possible stroke's coming in. And so things just go boom, 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 boom.
The hospital has already achieved the program's bronze and silver medal performance achievement awards.
We have one of the best outcomes in the country for hemorrhagic strokes. We have neurologists on call 24/7. We have therapists here 7 days a week. So the patient is seen by therapy their very first day that they're here.
They're not only using the program and doing the right thing, but they're doing it well.
Throughout the hospital, Barnes employees wear cards listing the 7 signs of stroke under their ID badges. That way, even non-medical staff can spot and act on a potential emergency. Barnes also has one of the best door-to-needle times in the nation when it comes to administering TPA, the life-saving, clot-busting stroke drug that Darnell Marshall received.
Usually the patients that get TPA here right now are door-to-needle time is 56 minutes.
That's crucial because under FDA guidelines for teaching hospitals like Barnes, TPA must be administered within 3 hours of the patient's first symptoms. So if Marshall had gone to a different, less specialized hospital first, he might have missed that window.
He could have ended up in a nursing home, still in a wheelchair.
Instead, Marshall walked out of Barnes just 5 days after his stroke. Patty Garavaglia had a similar outcome after suffering a hemorrhagic stroke at home.
I had to sign a waiver because actually I'm closer to another hospital, but I wouldn't let them take me anywhere but Barnes.
3 days later, Garavaglia was well enough to go home and begin living a healthier life.
Amazingly, how they can walk away with no residual after a stroke if the right care has been given to them.
Mycle Brandy turned his life around by quitting smoking and deciding to get fit after his 4th and hopefully final stroke. As he visited Barnes' neurosurgery intensive care units and neuronursing units, he offered hope to other stroke patients.
I have some stroke survivors that are actually going to walk with me the last 200 miles into Washington, D.C.
After that, Brandy will fly to Athens, Greece to walk in his 10th marathon.
There's hope after stroke that, you know, things can and will get better.
I'll tell you, the Seattle sunshine will put a smile on your face. 9:15 now on your Wednesday. And imagine the entire city of San Francisco, California having a stroke at the exact same time. That is 800,000 people, and that's how many people suffer strokes every year.
It is the 3rd leading cause of death in the U.S., and our next guest is determined to do something about that. We're joined by Mycle Brandy, and he's raising awareness for the early signs of stroke, and it is Stroke Awareness Month, so great time to do that. It is so nice to have you on.
Thank you for having me.
And quite the story that you have. You are a 4-time stroke survivor. You're 62 years old. Tell us about your story.
Well, I had my first stroke in 1988, and I got a little depressed, and I was a professional singer, and so I lost most of my hearing. So that was kind of depressing, not being able to hear and sing. But instead of letting myself be depressive and fall into a slump, I decided to do something about my life. So I went to law school, got my Juris Doctorate. That wasn't quite enough, and so I got a postcard in the mail from the American Heart Association inviting me to train for marathons. So my wife Louise and I, we decided to go and train, and we did our first marathon 2005, June 2005, at San Diego Rock and Roll. And since then, I've been doing a lot of walking. Well, I did 9 marathons. And I got to a point to where I wanted to do the Athens Classic Marathon in Athens, Greece. And in 2010, it was the 2500th anniversary of the Battle of Marathon. So I really wanted to do the Athens Classic Marathon, and that was going to be my 10th marathon. So I called up a reporter and I said, I'm going to do this. And I thought to myself, that's really not enough of a story for him. So what else can I do? So I thought about it, and before I even mentioned anything to my wife, I said, you know, I think I'm going to walk across America. And he just started writing 1,000 miles an hour, right?
All right.
So I stuck my foot in my mouth, and I get home, and I said, honey, I got some bad news for you.
We're leaving.
Yeah. Well, no, I'm leaving because, you know, she needs to keep her job.
I'm going on a little walk.
So, yeah, so I went on an 8-month walk, and it took me from, I started on Valentine's Day on my 59th birthday in 2010,
Amazing.
and I completed it on October 10th, 10/10/10 in Washington, D.C. I received a letter of congratulations from President and First Lady Obama. And so then I went home and I started working on a book, and then I got bored and I said, well, I think I need to do one more walk. And, you know, I haven't
walked. And now you've done it. Now you've walked across America 3 different times, and you're looking to do it again, right?
Three different segments. Now, the first one was from coast to coast. The second one was from San Diego to here, Seattle. And I finished that second walk at Virginia Mason Hospital, which I'm going to be at today, this afternoon. I hope everyone will come down for our little party that we're having this afternoon. And then last year, I walked from Madawaska, Maine to Miami Beach, Florida.
What's the weirdest thing that's happened to you on these long, long walks?
Probably the weirdest thing, I was in Oklahoma, and I was sitting on a guardrail, a metal guardrail, and I could see in the distance a black cloud that was, you know, miles and miles and miles away. And within moments, that black cloud was on top of me. And so I called up a guy and I said, you know, you better come and get me and take me back to the hotel. Looks like it's going to be pretty bad weather. So I sat down on the guardrail and I'm waiting for him to come and pick me up. And as I'm sitting there on the guardrail, a bolt of lightning strikes and hits the ground about 25 feet away from me.
Oh my gosh.
And close enough to where I could see it kick up the dirt. And I said, maybe it's not a good idea for me to be sitting on this metal guardrail. So that was probably the closest I came.
My goodness. All right, so the event today happening where? What's the event this afternoon?
That's happening at Virginia Mason Hospital. And
okay. And here's it's right here. It is called Strides Against Stroke, happening at Virginia Mason from noon until 12:30. Admission is free. Admission is free, I should say. And Mycle Brandy, a pleasure to meet you today, and good luck on this next walk.
Thank you very much. I'm hoping to do the northern part of the United States from Portland, Oregon to Portland, Maine.
Nice.
But I have to find a sponsor first. My wife won't let me do it without a sponsor.
Thanks for joining us this morning.
Mycle.
All right, at 9:20 now, still ahead. Netflix is losing thousands of movies from its collection.